Hi, I'm Josie and I'm the Communications Officer here at Dementia's Platform UK. And today I am speaking with Dr Atticus Hainsworth, who leads the Vascular Health theme of our experimental medicine incubator, about all things vascular health. Now, Atticus, would you like to introduce yourself for us?
Hi, I'm Atticus Hainsworth. I'm a neuroscientist based at St George's Hospital in London, UK, and I work on vascular cognitive impairment and dementia.
Great, thank you. Let's get straight into it then. First of all, how does the vascular system relate to dementia?
The blood vessels of the brain are crucial, of course, to supply blood and oxygen and nutrients, all the good stuff that the brain needs. And if as we get older, they don't supply the nutrients quite so well, that can contribute to the process of dementia. And it's reckoned that in fact, in most cases of dementia, most dementia diagnoses, there's a vascular component. There's some pathology due to a malfunction in the blood vessel that is contributing to the dementia process. And that's important because it may be differently treatable, differently druggable, just amenable to other interventions alongside all the attempts to treat the Alzheimer process and the neurodegeneration and the amyloid and the tau and so on. And I think that's what attracts my colleagues and me to working on the brain vascular system.
If the vascular system underpins most types of dementia, then what is vascular dementia specifically?
Vascular dementia is probably a series of little vascular lesions, little areas of vascular damage, usually in subcortical areas, the deeper areas of the brain, and particularly affects the white matter, the sort of connections between nerve cells within our brain, and that if those vascular, they're sort of cumulative. It's like a death by 1,000 cuts. Multiple little areas of damage ultimately add up to a dementia diagnosis. Now, as I want to say that vascular dementia is probably quite a rare thing. It's more that there are bits of vascular damage in most dementia forms. There is vascular damage alongside most dementia types, be it Alzheimer's or Lewy body or frontotemporal.
What can we do about this? Is there any way we can improve our vascular health?
Well, that's the great opportunity. Certainly control of blood pressure, as in so many things, control of blood pressure seems to be a real positive intervention. And what we don't have is a sort of evidenced targeted therapy, a magic bullet to ameliorate the vascular cognitive impairment that we've been talking about, the sort of microvascular change in older people. We don't yet have that. Well, that's exactly what we're working towards, alongside trying to treat the better known Alzheimer's type dementia. And ideally, treating those two will lead to better therapies, better outcomes for people with dementia as their neurodegenerative forms are treated alongside their vascular forms of dementia.
Yeah, so it's kind of a multi-pronged attack that we're trying to achieve for dementia.
Perfect. That's a great way to say it. It's a double-pronged attack. It's attacking the neurodegenerative processes like amyloid and tau, and it's also attacking the vascular disease, the age-related vascular disease, primarily microvascular disease, and very likely, if we could make an impact on either of those, it would have real benefit for people's quality of life and extend the good years that they have.
one way that we're doing this is DPUK's Experimental Medicine Incubator, which is basically an engine that powers clinical research by aiming to reduce the time and the cost and the risk of drug development. And a strand of the EMI is a vascular health theme. So what is the vascular health theme of the EMI doing, and what is it hoping to achieve, Atticus?
Well, that's a really good question, and thank you. So I lead the vascular health theme within the DPUK Experimental Medicine Incubator. It's a network of researchers around the UK who are focused on vascular health and brain vascular health in particular. Globally, we recognize that we lack clear therapeutic targets in vascular cognitive impairment. We don't have drugs that are designed and evidenced to treat vascular cognitive impairment. We need them. We're working towards them. And a great obstacle here is the need for more clinical trials in this area. And a clinical trial is like a big experiment in a lot of patients where we test whether an intervention works relative to a placebo. And the idea of our network is that we're sort of trial ready. We've got these centres, we've got hospitals around the UK with expert clinicians in this area and with patient cohorts that are well understood, well known, and ready to enter a trial. And that's a very rich resource. We've got all the detailed data that is housed within Dementia Platform UK at its sort of base camp. And the aim is to engage more and more with the pharmaceutical industry and commercial partners who are seeking to take a therapy forward, but perhaps don't have the data or the confidence to do that. Of course, it's a big financial investment. So our network is there to help generate that crucial feasibility data, the initial sort of evidence of efficacy data that would allow them to go forward with confidence into a bigger trial with a drug to test for possible benefits in vascular cognitive impairment.
Sounds like really the missing link between great ideas and really getting them to these large-scale experiments.
It is indeed aiming to be the missing link between the sort of laboratory and the bench and the test tube, where great ideas are being generated, and the realities of clinical practice in real people with real dementia disease, and just helping to bridge that gap, to take ideas from the bench to the bedside.
Perfect. And that's a massive task. What in particular are you focusing on in your research?
A major cause of vascular cognitive impairment is brain microvascular disease. This means aging process, a wear and tear process in the smallest blood vessels that take blood deep within our brains. They're tiny little arteries. They're not what you usually think of as an artery. These are really thin. They're the thickness of your eyelash, and they're sort of long, thin supply pipes. And as you get older, they may get a bit thickened and a bit sort of stiffened and fibrous, and that means they don't carry the blood so well. They don't deliver enough blood sometimes, and that can lead to cumulative damage over the years. And that's probably the sort of substrate, the basis for most vascular cognitive impairment. And we don't really have therapies for that right now. We acknowledge that we lack drugs in this area, that the aim, the goal of our group within the Dementia Platform UK is to deliver novel ideas, novel targets for drugs that have potential in that area. It's a sort of shortlisting process of taking the best evidence to say which drugs should we be sort of having as our top line ones to trial in going forward into clinical trials.
That makes sense, because while it would be great to test them all, you have to prioritise, which I guess is the aim of the EMI.
Exactly, that's a great way to say it. I guess success would be coming up with a short list of molecules or drug classes where we have evidence and we've prioritized them as the best candidates to take forward into a clinical trial to test for efficacy.
Earlier you mentioned about the vascular network. What exactly is that, and who's involved?
The Vascular Health group within Dementia Platform UK is a network around the United Kingdom of the major centres for vascular cognitive impairment research. And that's not just my own centre at St George's University of London, but there are several other locations within London, University College, King's College, and looking further afield in Manchester, in Nottingham, the old universities, Oxford and Cambridge, University of Southampton, Newcastle, Bristol. North of the border, we have a big contingent in Edinburgh and the University of Glasgow, and a colleague in Queen's University Belfast. We also have our not-for-profit representatives from the British Heart Foundation and the Alzheimer's Society, who we're very grateful to have as supporters, and our pharmaceutical industry rep, Dr. Tom Blackburn of TP Ventures, based just north of London.
All of these people are in this network and all of these organisations. How does that actually work in practice? Do you collaborate with each other on research papers, or is it more general than that?
So we have monthly meetings of this group just to keep our momentum, and we've had some very productive face-to-face gatherings over the last few years where we get together in Glasgow and most recently in Manchester to discuss a particular theme. And that's been great, particularly in the last one, where we were able to engage a substantial number of early career researchers from across our network. And that was great to have that interface from the sort of opinion leaders with the early career colleagues. And these have led to writing manuscripts together. And then across the network, we write grants together to seek funding for a particular project. And it's been very productive in that researchers who might otherwise be working in competition end up working in a collaborative way. And the Dementias Platform UK has been quite instrumental in allowing that to happen, which I think we've all enjoyed.
I think that's the really important element, taking out that competition so that you can share ideas and bounce off each other rather than almost keeping secrets until things are ready to put out into the world.
Exactly. It's been a much more cooperative, collaborative, open environment. I think that's very much the way we should be going. We're very aware that we're in a global research community, and to work together within the UK very much plays to our strengths. And the big success would be if we could engage a pharmaceutical industry partner who wanted to work with us and work towards a trial. So
are there plans to extend it beyond the UK at all, this network, or would that encounter kind of feasibility issues?
I really relish that sort of international collaboration. I'm very much part of the Alzheimer's Association based in Chicago, and there I've been fortunate to be involved in their vascular health network, which is even bigger. It's global. It has 700 plus members. That offers, suppose we do have an idea for a trial that comes good within our UK network, there's a sort of ready-made global network there that I'm very much part of and that we could tap into.
Well, it seems like you're almost in a breakout group already. So you have this global network based in Chicago where everybody or kind of thought leaders can come together and then, like you say, disseminate that to the smaller groups where you can maybe have easier conversations with a smaller group, but then take things forward, vice versa, if you need the help of the larger group.
Absolutely. And for another advantage that it brings is, for instance, part of this global network that I mentioned under the Alzheimer's Association, a big part of that come from lower and middle income countries. So that brings us into direct contact with colleagues in the Far East, in Africa, in South America, in the sort of global South that we wouldn't necessarily come into too much contact with, but are just as plagued by dementia as we are. It's, dementia is not a rich country's problem, it's a global problem. And if we do find we've got a good idea and that we've got an intervention that's working, to roll it out to the whole sort of global catchment area would be very much worth doing, particularly if we could find an intervention that we could deliver at relatively cheap cost.
And of course, each countries have their own kind of unique variables. So researchers all over the world will have different things that they can bring forward based on what their populations experience.
Exactly, absolutely. I think the bottom line is to realize that vascular health and treating brain vascular disease has real potential for treating dementia. And that would be alongside any potential treatment that may come for treating Alzheimer's disease or frontotemporal or all the other kinds of dementia.
Perfect. Well, thank you so much. That was really interesting. And good luck with the rest of your research.
Very much, Josie. That's great talking to you.